This is the reading support then for the case study on the fight against lung cancer. The use of science and technology in diagnosis and treatment and the role of government. Lung cancer used to be rare, but it has become more common since the 1900s and is the second most common cancer today. Every year, 40,000 people are diagnosed with lung cancer. Medicine has proved that cigarette smoking is the major cause of lung cancer. Smoking was very popular during the early 1900s and rates of smoking increased during World Wars I and II. Pleasingly, smoking rates in the developed world are down. 90% of cases of lung cancer are caused by smoking or passive smoking. Lung cancer is a difficult disease to diagnose, and this means it is only when the cancer has spread that the symptoms start to develop. Only 1 in 3 people live as long as a year after being diagnosed. Only 10% live more than 5 years after being diagnosed. Other cancer types have much better survival rates, where 50% live for at least 10 years after diagnosis. The fight against lung cancer has many different elements, and medical professionals are working to improve prevention, diagnosis and treatment. Governments have launched campaigns to prevent people developing lung cancer. Government advertising campaigns warn people of the dangers of smoking. Cigarette advertising has also been banned, and more recently, laws have been passed which means cigarettes have to be sold in plain packaging with large health warnings. Recently, laws have been passed to hide cigarettes in shops and make it more difficult to purchase them. Laws have also been passed to make smoking in public places illegal. Through the NHS, the government has also invested in improving treatments which are also dependent on developments in science and technology. However, at present there is no national screening program for lung cancer because the technology does not exist to pick up the signs of lung cancer developing in the body. There have been a number of key treatments for lung cancer during the 20th century. Key treatments are detailed in the table below. Firstly, surgery. Surgery has been used since the 1930s, but many lung cancer patients have other health problems which have meant surgery could be too dangerous. New surgical techniques like microsurgery have meant that the patient can be operated on with much less stress on the body. Radiotherapy uses beams of radiation to target and kill the cancer. More recently, techniques have improved which target the cancer more accurately and do less harm to the rest of the body. Chemotherapy. If surgery and radiotherapy are unsuccessful, chemotherapy is used. This involves using chemical medicines to attack the cancer cells. Unfortunately, chemotherapy can cause significant side effects. Immunotherapy. Lung cancer can resist the body's immune system, and so trials have been taking place on how to boost the immune system, so stopping the cancer cells from resisting it. The battle against lung cancer shows how different factors we have studied during this course are now working together to improve medicine. For example, the government, science and technology.